My job is to help you live long, happy, confident, and to give your best, to help you to give your best. All right. So today I'm going to give you couple of tips, what I think is very essential. And this is a human skull, as you'd agree. A lot of people will be asking, what about my cholesterol? What about my sugar? What about my kidneys? What about my everything? As you know, I'm an aesthetic doctor and a medical doctor. I tell them definitely take care of it because that's the foundation. There's no point in decorating the tip of the iceberg when the bottom of the iceberg is rusting. If your blood vessels are clogged, if your kidneys are failing, if your liver has fatty liver, I don't think just masking it is the solution. So I encourage my clients by doing this, try to match up the internal, and that's my suggestion and advice for all of my clients in my both practices, right? So here what I'm going to talk about is when people are asking, why do I need to do fillers? Why do I need to do Botox? Why do I need to do collagen stimulation? Why do I need to do PRP or anything? Is because for me, it's a medical necessity. For me, it is preventing your aging in this part of the most powerful part of your human body, which I would believe, because here, this is a driver. This gives us confidence. We have the brain, we have the consciousness, we can think about, we make rational decisions, we do logical analysis, synthesis, and executive functioning, right? All that is being determined by what's here predominantly, right? None of us are going to be, in my opinion, want to take the challenge of running our life for 1 month without looking at ourselves, not looking at the mirror, not looking at a selfie. I like my clients to consider it if you can. I'm talking about the average clientele, okay? Try to go 1 month without looking at yourself. We always want to make sure I'm being accepted, I'm looking okay, I'm presentable, isn't it? So presentability, it's not only what's in the surface, it's also the foundation. So where we are using fillers is to remodel some of the structures, especially if there's bone loss. Bone loss here, bone loss here, bone loss here. We lose bones everywhere, including our hips, hip joint, as well as the spine. So we also have on top of this different structures. We have a fat layer, we have a muscle layer, we have nerves, blood vessels, and the rest of it. Guess what? At 30 years, we start the aging, and all of these things will start to degrade. Muscle tone here is going to be diminishing, muscle tone here is going to increase. So the it become more bulkier and pull down. And if you see most of the time, children's volume is here more, lesser here, adults more volume here, lesser here, right? You see the shaping, and that gives the aged appearance. So I tell to my clients, this diagram shows how our face is, right? You see how the muscle structures